So as I get started today, again, a big thanks to Wellpoint. Yolanda Frazier is the Washington Whole Health and Equity Director for Wellpoint. And like I said, that at some point she's probably going to join us and we'll allow her to say a few words to us about the purpose of Wellpoint being involved in this work. But we're going to kick it off right now with sharing a little bit of video, and I'll let Hybels introduce this video to us.
Yeah, so we're just going to watch a quick video here, and we're going to learn here about Count the Kicks and the impact it can have. This is a story of an Iowa mom who used our Count the Kicks app to help save her baby's life.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the third trimester.
For the ECOFs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did, and when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes, so when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, "You're going to have an emergency C-section."
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
Okay, so now Coleman's going to start a poll for us. So we want to hear about if you've heard about Count the Kicks before, if this is your first time, or if you have heard about our program before in the state of Washington. So it looks like so far about 80% have heard and about 20% no. So hopefully we'll give you all some new resources today to help implement Count the Kicks. So what is Count the Kicks? Count the Kicks is a highly effective evidence-based stillbirth prevention program. We were developed here about 15 years ago in Iowa by 5 Iowa women who each experienced a stillbirth or infant loss. And we've developed a proven early warning system for expectant parents. And so far, we've saved lives in 36 states and 5 countries. We want you to know our program is super easy to use. It is plug and play. It's so easy to implement and share with the expectant parents that you work with every day. And in this webinar, we're going to give you the tools and the resources that you need in order to implement Count the Kicks in your work setting. So first, we'd like you to meet Baby Saves Abel and Weston. So Weston is there on the right, and a little bit about Weston's story. His mom, Emily, is an ER nurse, and she was doing some Google searches to prepare for her pregnancy and found out about Count the Kicks. She wasn't sure about monitoring baby's movements, but then learned from the app that it's important to do so. And we'll talk about that more as the webinar goes on. But she says, one morning, I spent 4 hours at the computer, concentrated on work and realizing I couldn't remember him moving. I was exactly 40 weeks and was used to his aggressive elbows and feet by this point. So Emily talked to her husband. They decided to go to the hospital, and after some monitoring, they realized that Weston was in distress and that he needed to be born immediately. So she says, my advice, even with a full-term, completely normal pregnancy, count those kicks and educate everyone you know. It really can happen to anyone. So we're so grateful that Emily was using Count the Kicks. She was monitoring her baby's movements. She knew what was normal for Weston, and she sought the care that they both needed at the most important time. So before we go too much further, let's discuss the tragedy of stillbirth in numbers. So first of all, what is stillbirth? Stillbirth is defined as the loss of a baby after 20 weeks of pregnancy, and this is a public health tragedy. Stillbirth is so much more common than people realize. We talk about SIDS, we talk about the Back to Sleep campaign, but people are not talking about stillbirth. And actually, 1 in every 175 pregnancies will end in stillbirth in the United States states, which means 60 babies a day are born still. And additionally, there's our disparities that exist that are absolutely unacceptable. So in viewing this slide, you can see that there's clearly vast differences in the stillbirth rate affecting Black, Indigenous, Native, Hawaiian, and Pacific Islander families. And we at Healthy Birthday take these numbers very seriously and let them guide the work that we do in each state. And these disparities, they exist and persist and need to be addressed through systems change. It's also important for our organization to understand the conversation in your state and the data in your state. So these numbers on your screen were collected from CDC Wonder, and they're based on a 5-year average. And the time that we have right now is from 2017 to 2021. And so on average in the state of Washington, 476 babies are stillborn every single year. And we believe with statewide implementation of Count the Kicks, we can save 152 Washington babies every single year. And in order to do that, we need you to implement our program into your work setting. And we'll talk about how to do that in just a little bit. But for now, I'm going to pass it back over to Coleman.
Thank you. So we want to talk a little bit about the causes of stillbirth. And the thing is we don't know exactly why stillbirth happens. There are some contributing factors. You can see there on the screen that some of the research study has indicated problems with placenta, birth defects, infections. In fact, we are seeing a huge, and probably you already know this, but across the United States, we're seeing a huge impact of syphilis. Congenital syphilis can result in a stillbirth. It does in almost 50% of cases. And so we do know that there is the possibility of that link there, but we don't always understand why a stillbirth happens. So one of the things that we want to make sure we call attention to is just the need for more information. And this is where fetal movement monitoring can have an impact. If somebody understands their regular pattern, as soon as they notice something is happening, they can take action. So want to make sure that everybody knows that there is some research out there that shows a change in fetal movement activity can show an increase of stillbirth. The study that is cited on this slide, this was a case control study and looked at the incidence of stillbirth with pregnancy or live delivery. Sorry, I'm a little distracted because I know Yolanda's emailing me right now. But the people who had reduced fetal movement were more likely to experience a stillbirth. So that is one of the reasons why we talk about the evidence base for our work. So we talked about the stillbirth rate by race and ethnicity. We want to share with you Nala and Sonara's story. This is told from the perspective of their moms, and share with you how they perceive that the work contributed to their baby's surviving delivery. Got a delay on my computer. I'm so sorry. There we go. Let's see.
I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Count the kicks it helped. It really did. It saved my baby's life. It really did.
She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if?
So this is Washington Baby Save Sawyer. As you've seen, we've already had 2 other baby saves in the state. So it's really amazing for us to get the information when we hear about a baby save in any state. But we're pleased today to be able to bring to you 3 baby saves. And I want to highlight the information is the same in this story as we hear over and over and over. The only red flag there is in the pregnancy is a reduction or a change in fetal movement monitoring. And I will tell you that in a webinar we were in a little bit earlier today, the question was raised, and I want to make it clear from the get-go, it's not just reduced fetal movement monitoring, fetal movement. It can be an increase in that fetal movement, a sudden increase, a sudden change in a pattern, either a delay or an increase is reason for someone to go to their provider. And I know Hybels will talk a little bit more about that coming up about the movements, but just comes to mind when I see these babies. And it's really important to notice that this is why we stress knowing what a pattern is. So what's the research? Let's get into kind of why this is considered a best practice in stillbirth prevention. Count the Kicks is based on something called the Norway study. So if you're familiar with our organization at all, you may have heard the story that we are founded by 5 Iowa moms who all experienced stillbirth or the loss of their infant at birth. They formed a social connection together. And when they were talking, they decided that they didn't, in their words, they didn't want anybody else to join their club. They wanted to do something about this. And so they went looking, they ran into this research study that you see here. And they met with Dr. Ruth Fretz. She's circled. She's an original researcher on this study. She is a practicing physician in Massachusetts. And what they learned from this study is the country of Norway was interested in reducing their stillbirth rates. And so they set up a practice that they would educate expectant parents on what normal fetal movement looked like in the 3rd trimester. And then they would educate those expectant parents that if they noticed a change in the movement, they needed to contact their provider, whether that was a physician or a midwife, to let them make medical decisions for that pregnancy. So they would go in with this information that they had. They'd been tracking movement daily, and then the physician or the midwife was able to make a medical decision on how to proceed, how to treat what they were seeing. So this led to a 30% reduction in Norway's stillbirth rate. So our founders saw that and they said, we can do that here in Iowa. We want to see this same decline. So the inception of this program of the Count the Kicks education, you can see that it takes off right around 2008. And you can see the red line is a national trend. This is the US national trend line. And those teal dots represent, and I'll highlight them here, those teal dots, that's the Iowa rate. And you can see that the trend line goes down. Now, around 2020, we have a pandemic. We have different things that influence this. Many states are dealing with syphilis and congenital syphilis having a huge impact on stillbirth. But again, we have a trend line that continues down here in Iowa. So that's the really important thing, is that we want to replicate the success of this campaign in the state of Washington. And that is what we are currently working on. We're in year 2 of our partnership with Wellpoint. We're glad you joined us today. I see Yolanda was able to get on, so we'll give her some time here in just a little bit. But we want this same success to happen for Washington expectant parents. Some other research points, we often get asked about anxiety. Is there, if we have somebody on this app and they're constantly like looking at their baby's movement patterns, isn't that going to increase anxiety? The research indicates that the opposite is true. 77% of our app users report that they feel less anxious because they're using this app. They are familiar with their baby's movement patterns. And 84% of app users state that regular tracking was associated with feelings of bonding with their baby. And there's some exciting new research that's coming out about the impact that this can have on women or expectant parents that have other young children. There's also some expectant parent research and perinatal substance use disorder that's coming out around that feeling of bonding, really being a unifying aspect to encourage people to go in and seek help. So bonding with baby is a really important aspect of this program, of the Count the Kicks program. Additionally, you may or may not be familiar with this, but the Hear Her campaign lists babies' movement stopping or slowing during pregnancy as a warning sign for the Hear Her campaign. So we know that the CDC is paying attention to fetal movement. We know that ACOG is paying attention to fetal movement, and we know that AWON is paying attention to fetal movement. So if you are a practicing nurse, you're probably familiar with AWON. This is the largest national organization we have for obstetric nurses and other specialties, but they released a practice brief that addressed the decrease in fetal movement in partnership with us. So the practice brief aligns seamlessly with the Count the Kicks education campaign and states explicitly that focused assessment and management of decreased fetal movement or significant changes in fetal movement patterns by perinatal clinicians is essential for improved fetal outcomes. So all of these QR codes, we're going to send out a recording of this webinar with the slides. You can scan them. If you're somebody who wants to get into the weeds, we highly encourage you to do that. So another resource that we have recently launched, and I am an author on this article, is the standardization of fetal movement monitoring using our Count the Kicks program. So really looking at the implementation within a system. If you are somebody who works in a hospital and a clinic, this article is right up your alley. How should this be taught to expectant parents? How do we standardize that approach so that we can continue to see an impact on the stillbirth rates? So I'm going to turn it back to Hybels to tell you a little bit about Mabel.
Thank you. So this is another baby save. This is Mabel, and Mabel's mom, Megan, said that the only red flag that there was a problem with my pregnancy was my daughter's change in movement. I'm so glad I had the concrete data from the app, which gave me the knowledge that something was off and the confidence to advocate for my baby. So again, that red flag that something was off with the baby's movement. Megan was using the app, felt confident to stand up for herself and her baby and go get checked out. And now Mabel is with her family safely. So this is why we do the work that we do. We're so glad that Mabel is with her family. Okay, so now we're going to talk about our wonderful Count the Kicks materials. So how do we get that 30% reduction in Washington like we have in the state of Iowa? And really it's through these materials, getting these materials in the hands of expectant parents. So I put a link in the chat. This is where you can go directly to order materials for free. And again, these materials are made free for you, for any provider in the state, thanks to our partnership with Wellpoint. We have app cards, brochures, posters in English and Spanish. We also have at-a-glance materials. We have wristbands, all available for you. So you'll see that it's a very whimsical theme that our materials have. We have permission from Dr. Seuss's widow to use the font and imaging like you would see in a Dr. Seuss book. So keeping the imaging light as we're talking about a serious topic. So we're going to talk a little bit, Coleman, if you want to go to the next slide, we'll talk quickly about our at-a-glance materials. These are more picture-based materials that you can give to someone, and keeping health equity and health literacy at the center of the work. We want to offer these that are more picture-based materials. So it's easy to understand, that our program is easy to understand, understanding to count babies' movements in the third trimester of pregnancy. So we're going to give you some time now to go directly to our website to place an order. Feel free to scan the QR code link in the chat. Yes, we have materials in Spanish as well. Looks like there is a comment in the chat. So we're going to play some music. We're also going to be drawing for a couple of gift cards. A couple of people that ordered during this webinar will be lucky enough to win an Amazon gift card. So we're going to give you some time. Go ahead and go to our website and order your free materials.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news talking this and that. fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Hey, go, bring me down. Can't nothing bring me down. The love is too high. Bring me down. Can't nothing bring me down. I said, bring me down. Can't nothing bring me down. The love is too high. Bring me down. Can't nothing bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy.
I don't know that there's any good place to stop that song because I want it to go all day, but we do want to continue. Yolanda, let's see. Let me see if we can get Yolanda here. We'd love for her to say hello. See if that works. Oh, I see somebody coming off mute. Are you there, Yolanda?
I am here. Can you hear me?
We can. Would you like to say hello to everyone and then we can keep going? I'll go up to your
Yes.
slide so everybody can see your beautiful face as you're talking. Here you go.
You're so sweet. Thank you so much, both of you, Sarahs. It is a blessing to be here. Please forgive me. I was having some unfortunate technical difficulties. Of course, we all know technology is not our friend, but Healthy Birthday and the Count the Kicks app are truly our friends. And I just want to encourage everyone on this call today to continue using this app. Sarah, I noticed earlier today that another or two twin babies were saved from someone on your board. So that is just magnificent. I also want to call out and wish you all a very happy 15th anniversary back on August 28th. This marks the day that this particular program was put in place. So I just want to say thank you to Kate, Carrie, Janet, Tifan, and Jan. And thank you also, Sarah, to both of you, Sarahs, for your commitment to this wonderful partnership. And I'll also just say, in an effort to improve birth outcomes, partnering with you all at Count the Kicks for me for a second year is truly a no-brainer, as it helps to eradicate the disparities we see within the maternal child health space by increasing prenatal care visits to decreasing maternal child health related deaths, of course, namely stillbirth. And I do want to also call out that we are so excited here in Washington because we continue to relish in this app saving two babies, to my knowledge. Baby Abel back in July of 23, and earlier this year, baby Weston. So that is just phenomenal. And I know that this app, you all, will continue to reach people and save their babies. Lastly, I want to bring attention to how this app now has a social driver of health feature. And this is wonderful. So when our members or anybody within the Washington landscape uses this app, there is an area where they can select to find more resources within the social drivers of health arena. Things like searching for diapers, formula, housing, and food. So Count the Kicks is just phenomenal. And Sarah, I cannot thank you enough for allowing me just to be here, just to be present. as Wellpoint Washington's Whole Health and Health Equity Director. We love this partnership and we will continue to support you and all of the other unborn children, as well as mothers and families. So congrats to all of you, and please, please keep up this very important work. Thank you so much.
Thank you, Yolanda. We really appreciate your support as well. So I'm going to pass it to Hybels, and she's going to tell you about having the movement monitoring conversation.
Yes, thank you, Yolanda. That was so sweet. I really appreciate your comments. Okay, so let's talk about why does movement matter? So movement is a really important way that baby communicates before they are born, and a change in baby's movements can be an early and sometimes the only warning sign that the baby may give when they're in distress. So think about when you are sick, when you have a cold or the flu, your movements change, right? You're not participating in your normal activities. You're maybe laying on the couch or in bed because you don't feel good. You slow down, and babies are exactly the same. Their movements become weaker in a time of distress. So when a baby's not feeling well, they're naturally preserving blood flow to vital organs like their brain and heart to conserve energy and self-protect. So when should we start counting movements? ACOG recommends to start counting at 28 weeks of gestation or 26 weeks if considered high risk or carrying multiples, because this is when research has indicated that a baby has established a consistent movement pattern that expectant parent can feel and track. And then what movements should we count? We want to be sure to count rolls, kicks, jabs, swishes, punches, pushes, really any movement except for hiccups, because hiccups are involuntary. And let's watch a quick video now to see how easy it is to use the Count the Kicks tools for expectant parents.
Whether you're counting on the go,
आराम से घबराइए मत.
your baby's movements matter.
Les mouvements de votre bébé comptent.
Monitor your baby's kicks, pokes, jabs, and rolls once a day.
Todos los días durante el tercer trimestre.
C'est l'occasion de communiquer avec votre bébé et d'apprendre ce qui est normal pour lui.
Bond with your baby.
Crea un vínculo con tu bebé.
सशक्त महसूस करें.
Sentez-vous autonome.
Confía en tus instintos.
Trust your instincts.
Ve al hospital de inmediato si los movimientos de tu bebé cambian.
L'application gratuite Count the Kick est disponible dans plus d'une douzaine de langues.
एप्लीकेशन डाउनलोड करें
or visit counttthekicks.org for more ways to count.
देर ना करें, आज से ही गिनती शुरू करें.
No tardes, empieza a contar hoy.
Ne tardez pas, commencez à compter aujourd'hui.
Don't delay, start counting today.
Okay, so now let's talk about our free Hallmark tool, our Count the Kicks app. Our app is available in 21 languages. It's on Apple, Android, and Apple Watch. You can set daily reminders to count the kicks, and you can even download your kick counting history to share with a provider or family member. So here is how it works. First of all, we want everyone to become a registered user, because that way your data will be saved. And so you can get a graph over time to see what baby's movements look like. Once you are a registered user, to start a kick counting session, we want expectant parents to sit down, put their feet up, take this time to bond with baby, like Coleman was talking about earlier. Maybe involve a partner or a sibling so they can be involved in the kick counting session as well. So once you feel that first push, kick, jab, or punch, you want to tap the blue footprint like you see on the screen, and that's going to start the timer. Every time you feel one of those movements again, you tap the blue footprint, and after the 10th movement, the timer will stop. And then the app will ask you to rate the strength of the baby's movements from fluttery to fierce, because research shows it's good to pay attention to the strength of the baby's movements as well. So over time, again, you'll start to see a graph. The app will give you a graph of the average time it takes that baby to get to 10 movements. And that's really the goal of our program and our app. We know that every pregnancy is different and every baby is different. So we want those expectant parents to know, how long does it take my baby to get to 10 movements? And if those movements are different one day, again, if they're really they're getting to those 10 movements quicker, or it's taking a longer time, then they have the data in hand from the app to take that to their care provider and say, something is off with my baby's movements. I want to be seen. And please download the app, get to know how easy it is to use, play with it so you can show the expectant parents that you work with. And like we were just talking about, we have our Find Local Resources page. If you're a registered user, you can search by zip code for free and reduced cost services like diaper care, diaper banks, dental care, WIC clinics, because we want to connect people with resources before a baby is born. And this is a completely free resources that app users can use. Now I'm going to turn it over to Coleman to talk a little bit about system implementation.
Yeah, thank you. And thanks for hanging in there with us. We are just coming around the corner. We'll talk about systematic implementation and misconceptions, and then give you some resources, including brand new this week digital education resources for you. So systematically, how can you implement this in the work that you do? So depending on what your office situation is, if you work alone, if you're a doula, you have a private practice, or maybe you work in a clinic, thinking about how these options might play into that. So one, if you have patients that you're discharging, maybe you're a WIC clinic and you're discharging somebody off of services, it's a reminder to them, hey, with the next pregnancy, when you come back and see us, we want you to use Count the Kicks app. When they leave their appointments and they're going into the third trimester, there should be a touch point with them to make sure that they're using the Count the Kicks. Use open-ended questions to ascertain how it's going for them. When you use the app, tell me how that makes you feel when you're looking at what your baby's movement pattern is. What are some things you're noticing? Just ask those kinds of questions. Training for the team, again, using open-ended questions, but think about every member that has a touch point with the person the expectant parent that's being seen. From checking into appointment, you can have our app reminder cards right there to, again, leaving, or maybe, and I'll skip ahead to the procedure wait downtime, they're getting checked in and they're getting their blood pressure done by an MA or CNA. You can have one of the questions be, tell me about using fetal movement monitoring. Tell me how that's going. Are you using the Count the Kicks app? That can be a place to do it. If they are getting blood drawn, they're waiting for a doc who's at the hospital delivering a baby and is running a little bit behind, or they're drinking our favorite drink, the glucola drink. That's a time where they can be in the app, they can be looking at those resources, they can be tracking movement and experimenting with what that might look like when they get to the third trimester. Those are all great places. After visit summaries, if you're someone who has EHR, the electronic health record access, we have some opportunities for you with that. We can help you integrate that into your system. And again, with those audio recordings, we've got a 10-second spot that just repeats. So if somebody is on hold and you want an audio message, there you go. We also have a waiting room video, kind of like what you just saw. So there's a lot of things that we can do systematically to implement this work. One of the things that we need to do, and I'm going to let Hybels talk quickly through our misconceptions, is combating misinformation and misconception. So we're going to share with you a couple of the most frequently asked misconceptions. So Hybels, take that away.
Great. All right, so the first one is my baby should get 10 kicks in 2 hours. So Coleman talks all the time about when she was in nursing school, and this is what she was taught. But now the recommendation to have 10 kicks in 2 hours is outdated. Again, we want every expectant parent to know what is normal for their baby. How long does it take their baby to get to 10 movements? That is the goal of the app. And then if they notice that their baby is taking, again, a shorter or longer amount of time to get those 10 movements, then they have the data in hand to reach out to their care provider. They can feel empowered. This is kind of like a data download for their intuition. They can take that data to their care provider and say, I need to be seen. Another misconception is if my baby isn't moving, I should drink something cold or eat something sugary to get my baby moving. So go back to when we were thinking about if you have the cold or flu or COVID, if you drink a bunch of Mountain Dew or coffee, right, you're ingesting a lot of sugar, caffeine, your movement is going to change because you've introduced an intervention. So that's going to be a false representation of how you're actually feeling. And what we want is to know what is the truth of the baby. We want kick counts to be best monitored without interventions like juice and candy. So if a baby isn't moving like normal, parents should speak up to their provider right away. And we've heard so many stories from parents where minutes and hours matter when it comes to stillbirth. So we don't want to introduce those interventions. We want parents to trust their intuition, trust the data on the app, and seek that care from a provider right away. So we've talked about some misconceptions, and we know there's a lot more out there. And we know that one place that people get their health information is online, and social media can play an integral part in that. And so please feel free to share our information on your socials, our evidence-based information to the expectant parents that you serve. And so we'd like to take a moment to share this post by Jen Hamilton. She's an influencer on social media and also happens to be a labor and delivery nurse. And we woke up one day last fall and she had posted this video without us knowing about it or any prompting from us, but we are just so grateful that she did. And she does a great job here of dispelling a common myth about using at-home Dopplers. So let's watch.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. Getting to know your baby's movements and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great. And this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
All right, so let's wind up with the next steps. So you can see on the screen, we have 6 easy steps to clean this up, but they're all interrelated. So make sure that you practice with the app. The best way to mitigate problems with people who don't know how to use the app is for you to be familiar with them. So it's pretty intuitive, but using the resource menu might require a little bit of help for someone. So practice with that. Order materials. We've given you the opportunity today. We really encourage you to get in those orders so we can send you an Amazon gift card. We want to get rid of those. So take the opportunity to get materials. Keep an eye out. You never know when Yolanda is going to give me permission to add a couple things to Washington. We will communicate that to you, but keep your eye peeled for new developments in our materials. Take the time to educate. Make sure that you're having a kick counting conversation with every touch point in the 3rd trimester. If you're a doula, you can have these conversations frequently during the 3rd trimester, and you can help do those reminders. Make sure everyone on your staff, if you have a staff, make sure everyone on the team knows about the importance of fetal movement tracking, and make sure they know how to dispel myths. That's another one. Encourage people to speak up and use the data to have empowered conversations with providers. Trust intuition. This is so important that we are trusting intuition and allowing expectant parents to speak up for what they know. And finally, this is a really important point. If you are a rural provider or you're associated with a county that maybe doesn't have a birthing hospital in a reasonable distance, have the conversation with the provider's offices. Ask them what they would like to do. If someone tells you they're having decreased fetal movement and they live 2 hours from the hospital, do you want them to call in on the nurse line or do you want them to start to the hospital? That choice is absolutely the provider's, but sometimes we don't think about the impact that the rurality can have, or if someone has to wait for buses to get to another place. Have the conversations. That's a great step to be involved and educate patients and staff how to expedite their concerns about movement. So really quickly to wrap up, put it in the chat. This is your opportunity. Thanks again to Wellpoint. If you would like CEs, everybody needs CEs. We would love to give you a free training. You will need the information, this code here on the slide that you can see. Going to that link and putting in savebabies dash, that's a dash, not dash WA. I can't do the W dash sound right now. That's a free training. We'll again send that on our slide link for you today. And then this is our brand new resource. So this can be found on the digital education page. I think Hybels can lift the link in for you. Brand new. So we don't have the printed materials available in all languages, unfortunately, in Washington, but we do have many free resources that are available in the languages that you see. We want to encourage you to engage with those. They can be shared on socials. They can be shared in emails. The one thing they can't be is embedded. If that's something that you need, please reach out to me by email. We can talk about what that looks like. But we are pleased to be offering that to you today. And then finally, and we're just 2 minutes over, but I promise we're on our way out. We'd love for you to follow us on social media and sign up for our newsletter. Our Healthy Birthday accounts are focused on advocacy and organizational work. That's where Yolanda learned about our twin baby save this morning. And then our Count the Kicks is more expectant parent focused, and you can absolutely use those for the families that you work with. So at this time, I will we'll see if there are any questions. We thank you for joining us today. It's really important that you're here, that we are having an opportunity to save babies with you. So we'll just see if there are any questions. Otherwise, we'll send you on our day. And again, another huge thank you to Wellpoint for being our sponsor.